Hi everyone, thank you so much for joining our presentation. We are a group of Marshall B. Ketchum students, and we are actually in the School of Physician Assistant Studies program here. So today we're going to talk a little bit about COVID-19 and providing some basics. We understand that there's been a lot of talk and a lot of panic surrounding this topic, so we really wanted to provide a platform to discuss this and bring some helpful information, some resources and tips to provide for you guys and to kind of hopefully make the situation a little bit more manageable and really provide a one-stop shop because we know there are so much information and really wanted to consolidate all of this and provide you guys with the best updated resources. We also created a website which we will kind of guide you through and give you a little bit of a tour through at the end of this presentation, but we also have the link so that you guys, for future use and reference, can utilize that as you wish. At this point, you should have already completed a pre-survey, which we are very grateful and thank you for. After this presentation, we highly suggest filling out the post-survey just for our reference to see how helpful this was for you, and if there could be any changes, we would appreciate that feedback as well. Okay, so what is COVID-19? It is called coronavirus of 2019, and this is really kind of a SARS part 2, if any of you are familiar with that when that happened before in the past. So it's basically a virus, and it belongs to the coronavirus family. It causes breathing issues in the nose, throat, and lungs, which I'm sure a lot of you guys have heard of. So it started in December 2019 in China, and the cases doubled all over the world and can affect multiple different organs in our body. The virus is small and can only live inside a living person or animal. It really requires its host because outside of a living body it can't survive, though there is some question how long it can survive for outside of the body. But we'll get into that a little later. So how does COVID-19 spread? So the virus spreads between people through close contact and droplets. So whenever a person sneezes, coughs, or talks, the droplets can transfer from one person's mouth into the other, or to the other person's body. The droplets can even be inhaled into the lungs. From touching infected surfaces or objects is another way that this can happen. And like we said, the virus can live on surfaces for a couple hours to even days. Different viruses have different lengths of times in which they can survive outside of the body. So which is really important why we have to, be cautious of things and surfaces in our home or outside that we're touching and also possibly spreading, such as cardboard, cell phones, kitchen counters, door handles, and even plastic. When you touch your eyes, nose, or mouth with dirty hands, you can expose yourself to this virus. On the next slide, we're going to show a quick video. It doesn't have any audio, but it gives a really great illustration about the spread and panic that's erupted and provides a couple tips and ways to keep us safe. I thought that was a really nice visual to kind of put in perspective of everything that's going on. Now we're going to talk about who is actually at risk of getting sick. So in the media and kind of in the beginning of everything of this pandemic, there was a lot of conflicting information as to who was more susceptible or the type of demographic that was actually getting infected. So now that this has been going on for a few months, we understand it a little bit more, and we realize now that anyone can really be affected by this. So coronavirus can infect anyone of any age, and we have seen cases from, kids to the elderly. But what we do understand, similar to most viruses, is that people at higher risk for more severe symptoms would be adults over the age of 65 and people who have underlying or already existing health problems, such as the ones that I've listed below. Just be aware, though, that these aren't always the case and can vary from person to person. Everybody is very different and can react to viruses in very different ways. So it's also very important that just because you don't fit any of these demographics for people who are a little bit more susceptible, it's still important to practice social distancing and maintaining good hygiene. Okay, so some of the signs and symptoms, it can really be displayed into mild and more severe symptoms. So here we're going to talk about the mild to severe symptoms. These start usually within a week after a person's been exposed to the virus, but just because you've been exposed doesn't necessarily mean you're going to exhibit or show any symptoms. These people are what we call carriers, and so they can still spread it even though they're not showing any of the listed symptoms that we have here below. So I'm going to go ahead and talk about these. So the most common symptoms that we've probably heard about in the news or in the papers is having a fever, cough, trouble breathing, or feeling tired or fatigue. But some other symptoms that people can have, because like I mentioned before, every body is different and can react to viruses in different ways. So some other symptoms that have been noted in clinic settings and hospital settings have been chills, sore throat, having muscle pains or aches, headaches, loss of taste or smell, stuffy nose, runny nose, and some, GI issues or upset stomach. So if you feel any of these symptoms, these are what we would label as being mild, we really suggest that you call your healthcare provider first before going into the ER, or even if you have questions, it's always best just to call your healthcare provider so they can give you further advice and instructions. If you can't get into contact with your healthcare provider, if you don't have one, a PCP currently, check with your state or local health department, and they can give you some good resources and give you some information as well. But we do have later on in our presentation giving you a couple other resources that we thought was helpful in the event you do exhibit these and you kind of want some quick answers. So next we're going to talk about more severe symptoms. So these include having shortness of breath at rest when you're not doing any activity, chest pain or chest pressure, if any new confusion has started, or if you're not able to wake up, or even the inability to stay and maintain wakefulness. If you're exhibiting symptoms of having a blue face or lips, this is usually due to the lack of oxygen. And with any of these symptoms, you really want to seek emergency care right away. These are the symptoms in which we would say call 911, call your local ER and let them know you're coming in so they can prepare and take the proper precautions for you. So the list of symptoms we have above, it's not exhaustive, so it's not a complete list. I mean, as we've mentioned before, there are still new findings every day. So if you have any of these or any other symptoms that you're concerned about, like I mentioned before, call your healthcare provider. They're going to be a really good tool and resource to give you further instructions. Like I mentioned before, if you wanted some quick answers and to kind of guide you if this is something that's emergent or if you can just stay at home and rest and take preventative precautions, this is a really useful guide from the CDC's website. It's called Clara, and she is a self-checker, And what she's going to do is, like in the picture here below, if you log in, you just put in your list of symptoms, and she creates this algorithm in which it can decipher if you should be seeking, immediate emergent care, or if you should just, call your doctor or treat symptomatically or just stay at home and isolate. So this is a really, really good resource, and we actually have the link right here. So if you're, have any kind of fear or question after having watched this presentation, you could definitely have this at your disposal and utilize it. It's a really, really great resource. Okay, and currently with testing and screening, we're grateful now that that's available to us. There's two current tests that are available. They're viral tests and antibody tests. So these are different in what they test for. So the viral test tests for a current infection that someone has, whereas an antibody test is a test to see if you've ever been pre-exposed to the infection. So it may not show that you have a current infection, because it can take about 1 to 3 weeks to make antibodies in our body after we are sick. Currently, what we are using now is viral testing, just to see if you are currently infected with the virus. So in order to do that, some of the the routine in which they do that is they use a nose and throat swab. It's a very long Q-tip that goes down your nose and throat. It's not the most comfortable thing, but it does detect current and active infection. So with this, some resources in some facilities are free. I believe they can also send it to your insurance, but we do have on our website a list of resources that can provide you with the nearest testing locations to you, and can also further provide information whether it's free of cost to you, or if it can be billed to your insurance. So next we're going to talk a little bit about treatment, because I know this is something that's been kind of talked about a lot in the news, and there's been a lot of different information surrounding this. So the most current information is that 95 to 97% of people with COVID-19 recover. So if you do get infected, the best thing and first thing you should do is contact your medical provider for further assistance, like we've been talking. They are going to be the number one go-to in the front lines to helping you out. So at-home supportive care is going to be the mainstay of treatment here. What that means is you're going to be treating this and kind of taking care of your body, is what I like to think of supportive care. So drinking lots of water and rest. So you're going to be able to kind of save your energy and really make sure you're just treating the symptoms as they come. So make sure you take Tylenol, which is also known as acetaminophen on the bottle if you are unsure. This helps relieve some of the symptoms like fevers, aches and pains that you may have, but definitely talk to a doctor to make sure that you're okay to use this if you haven't used it before. A lot of what's been mentioned out there is to avoid NSAIDs, which is non-steroidal anti-inflammatory drugs. This includes ibuprofen, which is Motrin or Advil, and naproxen, which is similar to Aleve. The reason why they're saying to avoid NSAIDs is because they've seen complications with patients who have a current infection of COVID. So they're not quite sure what the mechanism or reason for that is, but they're just saying, it's best just to avoid it and stick with acetaminophen or Tylenol. Another option is to isolate yourself as much as possible and limit contact with others. This is the main goal and the main way to prevent spread. Another way that you've heard about a lot is wearing a mask or face covering anytime there's a risk of spreading the virus. So definitely during this time, really be in tune with your body. Watch for signs that your symptoms are getting worse, and really just pay attention to, your body and listen to it. Do not take any unnecessary medications at home. So I know a lot of people think that you can take antibiotics, or if some people have had previous infections and they have antivirals lying at home, they think it's okay for you to just take this. However, that's highly, highly unrecommended. There are currently no drugs licensed for the treatment or prevention of COVID-19. So we bolded that just to make you guys highly, highly aware. You shouldn't be taking anything if you realize you do become sick, or if you're thinking to prevent it. You really should be talking to your doctor before you take any medication. So that was just a cute little video that kind of summed up everything that I talked about, really displayed the information pretty clearly. I'm going to go over a little bit more about how we can protect ourselves. That video was a really nice preview as well to this, but just to go over it, we're going to be talking about protection and preventative measures. So right now, this is the mainstay of how we can keep ourselves healthy. The main thing is, of course, washing our hands. So not a lot of people know this, but to effectively wash your hands, you want to get every surface of your hands and wash with soap and water for 20 seconds. I know a lot of people don't really think about this when they wash their hands, but 20 seconds can kind of be a long time, and longer than most people are used to for washing their hands. So that's really the goal, is 20 seconds. But if you don't have access to that, or if you're kind of out in public and you've been touching certain surfaces that you kind of feel iffy about, make sure you carry around some hand sanitizer, and you want to make sure it's at least 60% or more alcohol based. And I know with the current situation, some items are kind of sparse and scarce out in stores. So in our website, we did compile some information where you can make, a pretty good grade of alcohol-based hand sanitizers that do keep things pretty disinfected. So after this website, Jacinda, my other colleague here, will go ahead and show you where that is, so you can go ahead and browse that information for yourself. Another option is definitely staying away from other people at least 6 feet apart. We want to avoid touching our nose, mouth, and eyes, because that's just a really quick and easy entrance for the virus to get into our system that way. Just covering your coughs or your sneezes with a tissue, making sure you throw away the tissue immediately after, and then washing our hands. And then if we do wear masks or facial coverings, make sure it covers the nose and the mouth completely. I know it can be a little annoying and possibly uncomfortable, but it is the best way to really protect other people. It protects us as well, but it's mainly to protect other people. And, this is important when you're in public, and I know some counties actually enforce this as mandatory. So make sure you look into your specific county and see, what the orders are specific to you. And of course, if you're feeling sick, if you've checked through Clara or any other symptom checker, just make sure you avoid close contact with others. Just stay in your room, wear facial masks, do everything we've talked about, and just protect yourself as well as protecting others. Some other ways to keep safe would be to clean and disinfect common surfaces and objects in your home. So cleaning counters, appliances, door handles, electronics, toys, and phones. We want to limit the times that we have to go outside, but I know that's impossible. Everybody has things to do. Work is opening back up now for certain people, and, we need to run errands and we have things to do. So if you do go outside, just make sure you are wearing a mask and wearing it appropriately. If you do wear gloves, make sure you don't touch your face or personal items or any of those common surfaces that we talked about before. You really shouldn't be wearing these gloves all the time. It should just be a one-time use and disposing them right after. So just make sure you're aware of that, because if you're just using, the same gloves, you're exposing the gloves to different germs and multiple germs. So, reusing these and touching surfaces in the household are really risking contamination of those common areas. And then lastly, you want to stay up to date on all your vaccinations. It's really going to protect your health and keep your immune system thriving and as strong as it can possibly be. So masks and face coverings. Who should really be wearing these? Everyone. So except for children under the age of 2 or those who have trouble breathing or those who can't remove the masks by themselves. There is a specific way in how you should be putting on and taking off these masks. So if people have difficulty breathing, it's probably not best to do that because it does obstruct our breathing a little bit when we're wearing these. And just to be cautious about their health, we want to avoid using those in those populations. And then of course, kids under the age of 2, they touch everything, they get into everything. So it's probably not going to protect them as much as an adult who's conscious and knows how to use these. When should we wear them? Anytime you're in a community setting, such as a grocery store, pharmacy, outside, you want to make sure you're just wearing them pretty much anytime you're just out in public. Because again, it's not necessarily as important to, protect ourselves as it is protecting other people as well. So we just want to be cognizant to that and make sure we're doing our part to protect ourselves and others. If you're taking care of someone with a known COVID-19 infection, this is obvious. We should definitely be wearing a mask and face covering. And if we cough or sneeze, either sneeze into a tissue or if we have the mask and face covering, it's going to protect some of those particles being expelled out into the air. And why should we be wearing these? Like I said before, we're wearing these to protect ourselves, the people we love, our families, friends, just to help do our part to reduce the spread of COVID-19. So I mentioned before, there is a proper way to put on masks or any kind of face coverings. A lot of you guys and people in the general public are using, fabric or reusable face masks. They do discourage the general population to be using, those N95s or hospital grade masks just because we want to make sure those are used and conserved for the appropriate settings in which they were designed for. So with the reusable face masks, the way you're supposed to wear them is you're supposed to, again, wash your hands the 20 seconds, soap and water, before you put it on. When you do put the mask on, you want to make sure it covers your mouth and nose, and make sure that you're not touching the mask and avoid kind of repositioning it so often. If you do happen to touch your mask, you want to make sure you use hand sanitizer or wash your hands immediately. So a lot of questions come up about how to maintain or how to take care of these masks. A lot of them, especially the ones that we have donated over to your guys' facility, they are washer dryer safe. You would just use it in delicates mode, but I know not everybody has quick and easy access to a washer or dryer, and that can kind of be a little cumbersome to do. But so if you don't have that option, you can also soak in soapy hot water overnight, but make sure you allow it to completely dry before each use. Now, the current recommendation is that you have to wash the masks after every single use. Now, this may not always be feasible or easy to do. We have busy lives, busy schedules, and we're constantly running in and out. So a quick rule of thumb from what I researched is if you do have to use it, just make sure you're washing it if you're exposed to a lot of people or if you've been outside all day long. Now, if you do make a quick trip, outside to water your grass or outside to just have a quick walk, and if you're by yourself, you can kind of extend the between washes a little bit, but just make sure that you're aware of how you're properly supposed to be using them and also the way you store them. So you should be storing these reusable masks at home. You can either have them in Ziploc bags, paper bags, or even if you have Tupperware lying around, just make sure you have, if there's multiple people in your household, just, put sticky notes, you can write on them just with every person's name and store it in a place that's kind of far and designated specifically for these masks. I know in our house we have one drawer that's only designated for storing our masks. So that's another way that you're going to keep yourself safe too. And remember, masks are only effective if you also wash your hands. So why is physical distancing so important? I know you probably see here that we crossed out social distancing, and we're going to be using those two words, social distancing and physical distancing, interchangeable. So a lot of people I know have been feeling pretty down with not having contact with their friends or family members as often as they were used to before. So we think the name social distancing is kind of a little harsh because it leads to the preconception that you have to just isolate and be away from any kind of engagement or, social interaction with people. And that's not the case. You can still socially interact. It's just a little bit different. Like they say, it's the new normal, right? So this really is just physical distancing, having your bodies more distance way apart. So this is a good way to make sure that you're also keeping in touch with those people important to you and those who you love. So with this, that being said, the definition, like I said before, is keeping space between yourself and another person outside of your home. And the distance apart should really be about 6 feet. So anytime you're in a store, if you're going on walks, or if you're in a restaurant, just make sure you maintain that distance space apart. And you want to avoid gatherings and groups, so any kind of social event like parties, populated areas, really want to try to avoid those. Even now that things are starting to open back up, it is important to still maintain these precautions because the virus is still active, it's still, out there in the world, so we want to make sure we're just doing our part to protect ourselves as much as possible. And again, limit face-to-face contact with others, so avoiding shaking hands, hugging, and kissing. There are a lot of nice recommendations out there in how to kind of change some of these common contacts with other people. It's a new normal and we're getting used to it. And hopefully by maintaining some of these, we're going to be able to slow the spread. And again, wearing that mask to protect ourselves. Some other options, that we can utilize are these online delivery options for groceries and for medications. These are really great because it completely takes out the whole aspect of us having to go out in the public to get some of these needed household items. So those are really great and we highly recommend utilizing those. And then again, if you're unable to avoid public transportation altogether, everybody has different circumstances that we understand. Just make sure you're wearing your mask and keeping a good distance, feet apart from other individuals, and carrying around that hand sanitizer. So again, we're going to go over some of the homemade recipes and how to make some of those items yourselves if you're unable to find them in stores during this current pandemic. So remember, together we can flatten the curve, which means that we can slow the spread of the virus. Okay, so keeping our distance to slow the spread. Why is it important in the first place? So like we mentioned and touched on before, even if a person looks like they're healthy and, seems in tip-top shape, that doesn't mean that they don't have an active infection. Everybody is very different. So some people can, react and have no changes to their systemic health, and other people, it can really cause huge signs and symptoms. So, maintaining your distance is really the best way to protect yourself and protect other people too. Because you yourself can be someone who comes in contact and have been exposed to the virus and you feel fine. So, if we want to make sure we take care of our loved ones, we want to make sure just to keep that distance between us and other people. Each of us can really slow the spread and protect ourselves, our families, and our communities. This is our way and our contribution to these efforts in slowing the spread. And again, physical distancing works as long as everybody follows the rules and does their part.
Hi, I'm Jacinda, and I'm just going to help guide you through the next part of our presentation. So, some frequently asked questions. Let's go over these. Can COVID-19 infect my pet? So, although there has been some news about a few pets testing positive for COVID-19, the risk of pets spreading to people is actually low. So they did some research on this, and that's what they came to the conclusion of. So it seems that the virus can spread from people to animals, but you just also want to just be cautious and treat them as you would any other family member. So if you're out with your pet, walking your dog or something, make sure you also maintain a social distance away from others with your pet. If I had COVID-19 before, can I get it again? Currently, there's not too much evidence telling whether or not having the virus can protect someone from getting the virus again or how long they would be protected. So, if you did have COVID-19 before, you still want to maintain those precautions and make sure you're washing your hands, socially distancing, and wearing a face covering. What is known about the risks of getting pregnant or breastfeeding during this COVID-19 crisis? So currently, there is no proof that COVID-19 will affect pregnant women more than the general population, and there's also no proof that the virus can be passed on from the mother to the baby. However, as we say before, we don't know everything about this virus, so we do want pregnant women to still follow the same rules to prevent contracting COVID-19. If a mother does have COVID-19 and has a newborn baby, she can still breastfeed because the breast milk does not pass on the virus. However, of course, it is still recommended to touch and hold your newborn baby because the newborn babies do need touch in order to thrive. And you should also wash your hands before and after touching your baby and keep all surfaces clean. So the usual preventative methods. So this is just a list of our reference. These are great resources that you want to check to stay up to date on current news and information. So the WHO, which is the World Health Organization, the CDC, which is the Center for Disease Control, Orange County Health, and the California Public Health Department. And we also linked our website here for your easy access. Once we send you the presentation, you would be able to click directly to our website, but I'll just give you a quick tour right now. So if you typed in covid19oc.weebly.com, you'll see that this is our lovely website. Hopefully it'll be another great resource for you to use to learn about COVID-19 as well as just keep yourself safe and educated and informed and also taking care of your mental health as well. So as you can see here, the presentation we just showed you is also going to be here. So there's an English presentation and there's also a Spanish presentation. Additionally, if you see on the sides, on the right, there's a link where you can click, and that will lead you to more information about COVID-19 testing, as Amber discussed earlier. So here I'm going to click it for you, but with the Orange County Healthcare Agency, you can actually find out where you can make an appointment, what type of tests they do, and just more information about how you can get tested for COVID-19 if you ever wanted to. Additionally, on the left, earlier, Amber mentioned Clara, which is CDC's self-checker. So if you ever are experiencing any symptoms, feel free to click on this photo. It'll lead you to the CDC website, and the self-checker will also pop up, and you'll just have to answer a few questions. And going back to the website, if you scroll down, we're going to also have the recorded presentation right here for you. And here's a little bit more about us and why we're putting together this presentation as well as this website for you. This is our faces, so you can put a name to our face. And here's a sitemap with links. So if you ever wanted a quick and easy way to access our different pages, this is a great way to find those pages. And here I'm just going to help you navigate our website a little bit more. So under the resources category, we have actually provided you multiple resources on how to stay up to date on information. Like I mentioned earlier, you just got to click these links and it'll guide you straight to the website. And here's another post where a site where you can track COVID-19 cases and death. So Orange County has its own website where it's tracking the numbers amongst the Orange County residents. WHO also has a tracker for the entire world, and Kaiser also has one that's based off of WHO's information as well as Johns Hopkins University's information. The California Department of Public Health also has one. So as I mentioned before, COVID-19 testing and screening within the Orange County Healthcare Agency is going to be the #1 website you're going to go to, because that's going to tell you your local places where you can get tested as well as how to follow the directions and find the places. And here's some other testing websites or some resources you can use, but the Orange County Healthcare Agency will be your #1 go-to. So next, you can either click on these buttons here, Adult, Children, Family Activities, or you can click on these little buttons that I'm showing you. But here are some resources for adults. These are just some advice for parents. So these are references from the WHO that gave wonderful parenting advice about how you can talk about COVID-19 with your children, as well as how you can just take care of both you and your child during this time. And here's another post that we made about how you can talk to your child about COVID-19, because I'm sure they're just as confused as you about why they can't go outside, why they can't see their friends. So here's a great resource that you can use, and you can click on this for more details. Additionally, for adults, parents, everyone, if you ever need any mental health resources, here's a list that you can use, because there are many free apps on your phone that you can actually download that'll help you track your mood, track your habits, meditate, and so much more. And these are the top 5 meditation apps that you can download. They're either free or you have to purchase them, but they are definitely the most recommended. So if you ever need to take a mental break, feel free to take a look at these apps. Additionally, we have linked these mindfulness, self-care, and stress managing strategies YouTube videos for your reference in case you're interested in that. So next, I'm just going to go into the resources for children. So to educate your children, we actually made a quick video that's really fun and short, because I understand that your children may be a bit also confused about what's going on. So if you click on this, it's a really quick informational video for your child. Additionally, if you ever wanted to read a book with your child, here's a short children's book on coronavirus. So if you click anywhere here, it's going to open you up to this link. And it's a very cute book that's provided by, I believe, either the WHO or CDC, but it's recommended for parents to go through this with their children. It's very quick and simple. Additionally, if you have any older children, this is another book that will be helpful. And it goes into more detail and it tells a really fun story and just has more text. So up to you and your children to decide which books you want to read. Additionally, we have a Washi Washi song with Elmo. So I know it must be hard to get your kids to wash your hands at all, but maybe this little short video with Elmo guiding them will convince them to wash their hands. And it's really fun. It'll probably keep them entertained as well. And I know that many of your children are probably not in school, so if they ever wanted to do some learning, whether it be on like fun subjects or boring ones, or you can find them all on YouTube, PBS Kids or PBS Learning, and we've linked it all for you right here. So last in this resources tab, there's family activities. We just found some good websites that showed some interesting exercise or indoor activities that you can do as a family together or with your children. And there's also some indoor games too, because it's still important to stay active as well as keep your mind active during this time. So if you're able to do that, then that'd be wonderful. So at this time, if you remember the whole toilet paper crisis where all the toilet paper was gone, all the hand sanitizer was gone. So because of that, we want to have a DIY, do-it-yourself tab, where if you don't have the ability to purchase those resources, you could potentially make it by yourself. So as we mentioned earlier, it's very easy to actually make your own cloth face mask. So here's a quick video to watch the US Surgeon General demonstrate how to do that. All you would need in this demonstration is a scarf, bandana, towel, t-shirt, and 2 rubber bands, and put that together. And as we mentioned before, it's very important to wear a face mask. Even when restrictions are being lifted, it's still important to prevent yourself from catching COVID or preventing others from getting COVID. So here's another easy hand sanitizer recipe from the WHO. All you have to do is put these ingredients together and follow these instructions. And if you buy reusable little travel-sized bottles, you can just put it in that and take that with you wherever you go. And another recipe here is for Lysol wipes, as well as disinfectant spray formula using the CDC and WHO methods. And in our tips and advice category, we have some more information about masks and face coverings, because once again, we want to place emphasis on the importance of keeping your face covered when you're outside or if you're with people who aren't from your household. And this is just more information on when you should wear a mask and how to wear a mask. So as a note, mask wearing is currently mandatory in some counties, such as Orange County, but you want to always make sure you check with your local county before proceeding without a mask. And just as a general rule, I'll just keep one with you at all times just in case, because you never know where you're going to be going. And additionally, I know that many people have been financially impacted by COVID-19. So because of that, we wanted to put together a list of resources that you could refer back to just to help yourself out with these financial tips. So for example, there's unemployment benefits, things about 401k, tax breaks, student loan breaks, and emergency financial assistance. So you can just take a look at that. Last but not least, we have our Mythbusters tab. So I'm sure you've been hearing many crazy theories out there about COVID-19, and here are just a few that we wanted to debunk and let you know the facts because we use resources such as the CDC, WHO, and other reliable resources to help you stay educated. And we want everyone to be educated about COVID-19, especially because this is such a big current event that's been going on. So take a look at this in your free time. It's pretty fun to learn about because these are here because certain people think certain ways, so it's pretty fun to see this. And that is the end of our presentation as well as the tour for our website. Thank you all so much for attending this. We are so grateful that we're going to be here as a resource for you. If you have any questions, just let us know.